I have seen this term neurofluency, and I was curious for you to just begin right there at the concept of neurofluency.
Well, I think the thing that I've noticed that is the development of this idea that there's a neuropsychotherapy. It's obvious from the neuroscience data that one form of therapy is superior to another, and it seems like a cottage industry has grown up of people creating different forms of therapy with different sets of initials that are based on, rewiring the brain and all of that. And I think what I tried to think about in the term neurofluency was, how do we use our knowledge of the brain not to recreate the wheel and create some new form of therapy, which really are all old forms of therapy that get retreaded, right? I think in terms more like, for example, what does cultural awareness do for us, right? There isn't really cultural psychotherapy. What there is psychotherapy that is expanded and deepened by an awareness of different cultures and also how different people experience life and words and relationships in different ways. So for me, cultural awareness expands and deepens and increases the potential generalizability of therapy to more populations, hopefully. So when I think about neurofluency, I think about a different stream of thought from some kind of neuropsychotherapy, but thinking in terms of how does the therapist, whether you're a CBT therapist or whatever, Rogerian, Gestalt, whatever it is, your family systems, how do you become fluent in with using and understanding how the brain is structured and functions, and how do you add that into your conceptualization and treatment plan? So the book I'm working on now is called Neurofluency, and what I'm really trying to do is to educate people sort of like the backstory, the important basic component parts of science that I believe a therapist should know and be aware of and add to their thinking and help them coordinate and maybe integrate in some meaningful way different forms of treatment, as opposed to being a devotee of one form of treatment and sort of like if you've got a hammer, everything's a nail.
Yes.
But actually try to think about who the person is and what forms of therapy might be most helpful, and also challenge yourself to develop a scientifically organized eclecticism.